Mary. All right, I am bringing on Mark and Jennifer Ratner right now so we can transition on to our next session. And I will let you take it away here. All right, Mark. Oh, wait, nope, clicked the wrong one there. All right, Mark, if you're able to start your video, and Jennifer, sorry. Awesome. All right, thank you guys so much.
Great. Mark and Jennifer, thank you so much both for being here. This is great.
Hey, two of my favorite faces to see in the morning. Jennifer, she's going to outshine you a little bit, Chad. Sorry.
It's going to outshine me a lot a bit. Great. So we'll do introductions here. Jennifer, you are a private practice owner in Texas. Can you give a little bit of a background about your practice, how long you've been in practice, and really what you're doing with cash-based services? You're muted. You're muted, Jennifer.
Sorry about that.
There we go.
I am Jennifer Ratner. I live in Fort Worth, Texas, own a practice here, Ratner Center for Physical Therapy. Have been in practice for 5 years now, and it's been an amazing ride so far. Crazy. It keeps getting crazier. I started with 3 therapists. We now have 11, looking to hire the 12th. We've grown significantly, roughly 20 to 30, in certain years, 40% every year. And we started incorporating cash services in our practice immediately. With the use of Lightforce, I'd used it in a previous clinic, and it was something that I wanted to incorporate in my practice. So the Lightforce laser has been a cash service for us since the beginning. And we also incorporate wellness programs. I grew my practice so fast that I had to stop the wellness programs at this point, but we're looking to expand again and hopefully add some sports performance and wellness back into the mix.
Thank you, Jennifer.
Sure.
And Mark is a physical therapist from Nashville, Tennessee, also with Innovis, who handles both Lightforce Laser. You probably also know them as Chattanooga, Shockwave, as well. Traction devices, and also, Mark, your wife is a private practice owner in Peds, correct?
That's correct.
Great. Anything else you want to fill in the blanks there for our group here?
Yeah, I've just been in the medical education space since 2017, so I filled my brain with a bunch of stuff about therapy lasers and shockwave equipment, and to a lesser extent, traction and e-stim to get up to speed. So I support all that stuff for Chattanooga. It's a product you're probably familiar with. You've got a couple pieces of that in your clinic, I'd imagine. And that's the product line within Innovis, so lots of different branding and what have you. But my job is basically to help educate folks and make sure they understand how the stuff works. And I train all of our sales folks and our implementation team to make sure that folks like Jennifer, when they get going with their laser, that everything goes smoothly and that the information is on point.
Awesome. Thanks, Mark. By the way, for everybody here, there is a Q&A tab. If you have any questions for Jennifer or Mark as we're going through this session, feel free to type it in the Q&A, and I'll be happy to moderate there. Let's start at the beginning. Jennifer, you said you used Lightforce Laser in another clinic before you opened up. For a lot of us, we don't have that experience. How did you overcome, especially with the initial three therapists, how did you overcome that resistance that some of us go through around adding a cash-based service and asking for money for an add-on service that we're providing?
That's a great question. I think the therapists that had come with me were familiar with Lightforce. I knew in the beginning that we needed to be able to add cash services to our practice. And honestly, over the past 5 years, with declining reimbursements, it's become even more evident that in a small private practice like mine that doesn't have quite the bargaining power and negotiating power in terms of insurance contracts with the hospital system, you've got to incorporate something. And it's the challenges, and we're still having this challenge. I'm going to be really transparent. The challenge of getting your team on board with selling is challenging. We're still having these challenges. As I bring in new practitioners, many of them have not used laser before. We go through training with them individually Mark and his team have been great in terms of providing videos and Zoom sessions and those sorts of things to help integrate the use of the laser so the practitioner feels comfortable explaining what they're providing to the patient. I firmly believe that the proof is in the pudding. If you have practitioners that haven't felt it, haven't used it, and they have some sort of injury, let them use it on themselves. When they begin to realize the effectiveness of this tool, they then buy into it. They realize that there's some value to it. The other part of that is when they realize they see me using it in the clinic and patients are raving about it, they pay attention to that. And then they want to be able to provide their patient with something. I think practitioners get caught up in the fact that as healers, as practitioners, we don't like to sell. We find it icky. We don't like to ask people for money for services. Coming on this journey as a private practice owner, it becomes very apparent how really important it is to be able to increase the bottom line so that you can continue to provide benefits to your staff and grow your practice. So in a nutshell, it's challenging, and it's still challenging to get providers on board. But I think you educate them appropriately and continue to drive it home. It helps.
That's great. Thank you, Jennifer. Mark, you get to see this now in hundreds of practices and the challenges that we have. I think Jennifer nailed it perfectly. Most of us are wired to, we want to do everything for the patient and make $0. And then we wonder why our rep per visit is down, why our profitability is down. And, it's a complete disconnect. We want to be worth more in the marketplace, and this is an opportunity to do so. How do you work with practices to help the owner overcome that challenge?
Well, I think a key word in your vernacular when you're talking about this to staff is very important. Is sell is definitely a 4-letter word to most clinicians. So if that word is brought up during the training implementation process, you can almost guarantee you're going to get pushback. And what we try to coach folks up on, and I'm sure Jennifer picked up on this, but it's a nuancy thing, is really trying to get your clinicians to be prescriptive. So it doesn't matter if it's a laser, shockwave, whatever, a manual therapy program, or just generally their plan of care. It's extremely important for any clinician in your facility to be prescriptive with what they're telling and interfacing with that patient as far as what they're recommending and why. And so that's an important, it sounds subtle, but it's really important for clinicians because probably a chunk of your staff is not comfortable with being prescriptive. I've heard from young therapists tell me to my face, I don't want to be rude. I don't want to tell somebody what to do. I want to be nice and work with them. And they're missing the boat that people are paying their copay, they're paying their coinsurance to be in front of you so that you can tell them what to do to get better. And if that is an issue before you even think about a cash program, you better solve that first with your staff, and that usually can be picked up on with cancellation rates and some different things to sort of alert you to that, hey, maybe this is an issue. But once they can adopt that behavior of I'm going to be prescriptive and try to explain to my patients what's best for them via my recommendations, that's when these types of modalities fit in and slot in what Jennifer was saying about being able to see it, touch it, feel it, understand how it can improve a condition. Then there's a runway for that. But without that sort of initial muscle that's in place to really interact and interface with a patient in a meaningful way, it's probably going to fall flat. And Chad, I think you can even speak to that with your own crew that you've seen.
Oh yeah, we just had a major win yesterday, which was we had a PTA, Sarah McCormick, who just she had 4 packages in a week just with existing patient flow. Nice. So I'll use that as a segue for this. There are really 3 pathways that we can use to promote cash-based services. We can sell them to existing patient flow, or serve them, prescribe them, whatever we want to say there, right? Existing patient flow, we can use it for reactivations, which we're doing right now. And then we can also use it in cold traffic marketing to attract people who, and we just had somebody come through because of being on a directory, right, for a cash-based service, which was amazing. So Jennifer, let's go to you for your existing patient flow. How are you using your cash-based services and just presenting it exactly as Mark is saying, as a prescriptive part of the treatment plan? What does that look like?
So In our staff meetings, I advise all of our therapists that at the initial evaluation, I think the initial eval is where the magic happens. It's where you're going to set the plan of care. It's where you're going to set the expectations for the patient. At the initial evaluation is when lasers should be discussed. When you're discussing someone's plan of care and what you're going to be doing for them, I always incorporate that into that discussion. These are the things that we're going to offer you. We have an insurance talk as well so that they know what the cost of care is going to be. So there's no surprises. And ultimately, it comes down to saying we have a tool in our clinic. It's a light force laser. I often say that every major sports team in America has this laser because it gets their athletes back on the field faster and at a cellular level helps improve healing. If you have done your initial evaluation the way it should be done, your patient has already bought in. They have bought into what you're telling them. You've shown a level of expertise. You're setting a plan. You're giving people hope. They come to you because they're in pain, they're hurting, and now you have set up the right opportunity to be able to discuss the laser. The laser is a great tool that we utilize to help improve your healing. In our clinic, it costs $50 a treatment. If this is something that you choose to incorporate into your treatment, I highly recommend it. And so you pitch it at the initial, and many times for me at the initial exam, they're like, yeah, I'm willing to try that. Can we do it today? So absolutely, we can do it today. We discuss it. I often refer them also to my website where there's more information about the laser, but it's incorporating it right at the initial exam. What diminishes is when your therapists don't introduce it at the initial exam. I've got laser posters hanging around my clinic, and all of a sudden a patient goes, "What is that?" And they point to your laser sign. And then they're wondering why you haven't told them that you have this tool in your clinic that could help them. So then I think it diminishes your credibility to some degree at the fact that you haven't highlighted the fact that you've got this tool in your clinic to use. So it really starts in the very beginning conversations at the evaluation with the patient. And that's how we proceed forward.
Love it. Lots of questions coming in here. Thank you for that, Jennifer. So Jody asked, we used to incorporate low level laser therapy. Sounds like low wattage. And just a personal story. I know my wife just ordered something recently and I was like, hey, what's this? She was like, it's laser. And I said, what are we doing this for?
For her face, Chad. It's for her face.
That's exactly what it was for.
I was just at AOSSM and I was walking around the showroom, and of course Innovus was there and the Light Force was there, but they had a skincare product there and it was a laser for the face. And this woman wanted me to buy it. It was a couple $1,000s. And yeah, they're selling it for the face.
All right. So the Madden household is a sucker. Anyhow, and then it's delivered and I was like, let me see this. And I'm reading through all the specs and I was like, this is 0.15 watts. And she was like, this is the same thing you use in the clinic. And I was like, no, that's 40.
No.
This is way different. Different modal almost completely. But Mark, would love for you to
for the record, Chad didn't call me after this purchase. So I'm just gonna
absolutely. I was semi-embarrassed. But yeah. Anyhow, Mark, can you comment on the difference between because I know I had been exposed to cold laser or low wattage laser in the past, 0.5 or lower, and then I was treated myself in San Diego in 2017, right about the time you joined Lightforce, with high wattage laser, which is 40 watts. That's what we have in our clinics right now. I believe that's what you're using, Jennifer, and it's dramatically different. So can you comment on the difference in the treatment technologies?
Yeah, it just comes down to the amount of light that you can put into tissue, with the treatment. And what they've shown is when you put a lot of bright light or the laser into the tissue, it has a profound effect on pain. So that's a big difference between the lower power guys, the ones that you put on a piece of tissue and you let it sit there for a minute or a minute and a half, and then you move it to the next point. Those have the ability to help with, circulation and helping, spur on some metabolic activity that's going to help tissue heal. So I'm not saying that those don't work. They have a place, and they work especially well in superficial conditions. But for deeper conditions and for when you're trying to change pain, like within minutes, that's where the higher power devices really are differentiating. And research has shown on a variety of different conditions, carpal tunnel, plantar fasciitis, some different things in the shoulder, they've looked at low power devices versus high power devices, and the outcomes are just better with the high power. So it does a variety of things, I think, on pain, as well as getting to more cells essentially to help improve conditions better. So, I think I saw a question in the chat that asked like, how are people going to spend money on something that only takes a few minutes? And I think, Chad, you can tell your story is you put this device on somebody, and if you've never experienced it, all sounds like, yeah, whatever. But you literally can change people's pain within a couple minutes of treatment based on what it does to peripheral nerves. So you have a patient that comes in and goes, man, my neck, which was, I believe, Chad's issue, has just been stiff for, a couple of days. Got a couple minutes of treatment. All of a sudden, he's moving his head around without that same guarding and pain. And that impact on a patient is huge because whether you understand it or not, they're coming to see you for that, not for the laser, but for that relief. So whether it's a manip, dry needle, an exercise, whatever technique, or a laser, if you check the box and help them get out of the pain that they showed up for, it's a win. And the laser just makes it really easy to do that.
Yeah. And we just presented as a choice, very similar to what Jennifer was saying, here's treatment with laser, we can add this in, or without, which one do you want to do? It's very low. It's not like a hard sell at all. We recommend that you do this to expedite the healing. So very cool. The other question in here from Courtney is essentially a link for research. I believe it's through, is that the Enovis website? Mark, anybody can go to enovis.com and swim.
Yeah, probably the easiest place for getting direct laser stuff is lightforcemedical.com. So we're in the process of putting a very sophisticated medical ed site together, but right now we're still sort of behind the 8 ball. So lightforcemedical.com is probably your easiest place to get a lot of references if you're looking for something.
Yeah, and just as another aside to add on to what you were saying, Jennifer, the one thing that we found very beneficial is as we have DPT students coming through, or we do journal club or anything like that, we now sprinkle in laser research as part of the journal club, and that has been a game changer for us, where we're actually looking at the research and the efficacy of behind the treatment modality. So that's
and there's about 10,000 articles right now on PubMed, so it's not like this is some small amount of volume that's out there. It's there. Just make sure you look underneath either photobiomodulation or low-level light therapy, or the new one that's sort of evolving is HILT, high intensity laser therapy, HILT. Look around under those mesh headers and you'll get what you're looking for.
Thank you, Mark. Monica asks, how frequent do you do laser treatment on the same patient?
Depends on the condition. And Jennifer, I'll let you answer that. No problem.
Yeah, I think, ultimately every time the patient comes in, they can get a laser treatment. And I've had patients come in where even in between sessions, they'll say, can I get treated today, get laser? And, I don't see you again until next week. Can I come in later in the week for a laser? Absolutely. And, you can do it every treatment.
Yep.
Mark, if I don't know if you have another answer to that.
I think for most conditions, from the biggest picture, this laser is helping improve metabolism of tissue. So you're moving things through the healing process from inflammatory to proliferative healing. Obviously, once you get into the middle of proliferative healing, there's very little pain involved because substance P is pretty much gone at that point. So patients are really motivated to get from, an acute or early subacute phase into, a couple weeks down the pipe. So most packages that are sold are in that 6 to 8 visit range for that reason, because you're going to do a couple treatments a week, because that's how it works best over a couple weeks. And usually within about 2 to 3 weeks, patients are like, I don't hurt anymore. I feel great. There is still evidence to show that you could continue to use the laser, as Jennifer's stating, to help with improved, remodeling and things of that nature due to what it does. But most patients will say, hey, I'm good after a couple weeks of treatment because they're not going to be hurting anymore.
Yeah. So quite a few questions around this. Next, so we did the frequency. How much time do you block out for a laser only treatment? We just include it right in the treatment session. So if it's 45-minute or a 1-hour block, it's just included in that. Is that what you're doing, Jennifer?
Yeah, the big thing for us is making sure that the therapists are getting their units. If we've got a payer that's paying per code that we charge, like in our state, Blue Cross Blue Shield actually is one of our highest payers. So I'm encouraging my therapists to get 4 to 5 units under that, which is, roughly 55 minutes of treatment. Laser doesn't take very long in most cases. And most of the time, depending on what we're trying to do, either at the beginning of the treatment or the end of the treatment, many times I'm having my tech administer the laser. The laser, we train our technicians to administer it. There are times I administer it. There's times my techs administer it. We practice on each other administering it. So there's no difference between when I administer it versus my tech. So the patient doesn't think that because the tech is administering it, it's an issue. They're trained to do it, and it makes it super simple. So when I'm done, I'm out of a room, patient wants laser, technician comes in and is able to administer that. And I set all the settings.
Cool. Another question for you, Jennifer, from Oksana. I'm a lymphedema specialist. How do you decide how much to charge a patient for use of a specialized device?
You mean in terms of what we charge for laser, I'm assuming? So we have looked at going to packages, like Mark was talking about. We have not yet done it. We currently charge $50 a treatment for a laser session. Sometimes that session is 1 minute if it's a hand. Sometimes it's 6 minutes if it's a knee. So depending on the area size we're treating doesn't change the cost of treatment. It simply changes the time. And with these higher powered lasers on the appropriate patient, it's amazing how fast you can administer the treatment. So it's super fast. And for us, it's $50 a treatment across the board.
And I see a lot of questions around cost. I just want to give one perspective, which was I was talking with Guy, who Mark works with at Innovis, at an association event, and only because I'm in the equine world a little bit, at least my checkbook is very similar to the laser wrinkle treatments. I think we'll leave it up to that. But yeah, so we have 2 horses. In the equine world, they use a 25-watt laser because of the horsehair, and they will get upwards of on treatment on a thoroughbred of $500 for the same exact treatment technology in the vet world that we're charging $50 for. So part of the problem, if we're circling back to the rev per visit, is we ourselves are saying we're not that valuable in the marketplace, right? So we have a license to provide a treatment technology, and you can see if you just scroll through the chat how resistant we are to charging and asking for money for a treatment service that we can provide. Just calling it out. So Claro asked, how long did it take you to grow from 3 to 11 practitioners? 5 years, correct?
Yeah, 5 years.
Love it. Duration of laser, paid $50 every session. Isn't it hard? So Courtney asked, isn't it hard to not just include this in the regular therapy process? It is hard to have a tool you know works, but you can't use if they don't pay. Have you used it during treatment, and then when they are discharged, they can come in for it without a prescription? We do not do that. I'll just share that.
Yeah, I mean, in the state of Texas, they make it a little bit more difficult for us. We have direct access in Texas, but in order to administer treatment, the Practice Act requires us to have a plan of care. And, then you argue, does that require an evaluation? And when you talk cash services in the state of Texas, it's difficult for us, for a patient to come in. And I actually wrote the board about this because I was really frustrated by it. The idea of having a tool where patients can come in for laser treatments, if I have an active plan of care and that's all they want to come in for is laser once they finish their plan of care, I just keep the plan of care going. As long as the physician's on board that they're going to come in for laser treatments, I just have to have a signed plan of care. It becomes a little challenging when someone doesn't want to pay for an initial evaluation and all they want to do is come in for laser. But let's be honest, the reality is that we know the laser is a tool. It's not the only thing that's going to help get the patient better. It is a tool that we utilize to help facilitate their care. So the goal here is if someone comes into me and wants only laser, the goal is to convert them to a patient and sign them up for a full plan of care, because you're increasing your revenue by doing that. You're going to increase their outcomes by doing that. Is the laser great at helping promoting tissue healing? Absolutely. Is it going to speed up the process? Without question. But the idea is to get your patients in for a plan of care and use the laser as an additional source to help heal the patient, but also as additional source of revenue for your practice.
Yeah, and I think that's a real important point. Laser is an adjunct. So it's something that's a tool that'll help with all the other good things that we do in physical therapy. It's generally not a great standalone tool. There's some very isolated cases where that might be the case, and it can be used as maybe a management tool for chronic conditions like, knee OA and things like that, that just help keep their symptoms at bay. But by all means, it's best positioned to be a piece of your overall plan of care. that includes smart exercise, and all the other good things that we do.
Yeah. Great. I did see one more question in there. Just to clarify, Diana, I am a customer in the vet world. I do not administer laser to horses. Yeah, so I'm not, I'm buying it, right? So yeah, it's crazy. We have a horse that gets a massage and all these other treatments. Pretty
You're
well.
not going to bring the horse into the clinic, Chad? You could do some laser on that hind quarter, come on.
Absolutely not. Absolutely not, Mark. Anyhow, how about some love for Mark and Jennifer? And as we're wrapping this session up, we have time for one more question. Otherwise, Mark, what's the best place for people to learn more about you and Innovus, and learn about the other treatment technologies? I know we mainly focused on laser here. We didn't really get into shockwave or the other treatment technologies that you have. What's the best way for people to get in touch with you?
Yeah, I would just say go to lightforcemedical.com. If you want an in-depth, demonstration or what have you, there's a request a demo tab on there. Just click on that and put in your information. Somebody will reach out to you within a day or two. That's probably the easiest thing to do. So just lightforcemedical.com, and we'll take care of you if you can answer your questions.
Very good. Yeah, so got some love. Thank you. Hi, Mark. Thank you both from Lydia. Awesome. Thanks, guys. I have a Light Force laser as well. Great stuff. Thank you so much for being on here and sharing your time and expertise.
Thanks, Chad.
Absolutely. Good to see y'all.